Yes, good morning. It's a beautiful morning in Lagos, Nigeria, and I'm sure it's a beautiful morning, afternoon in China, and it is a great pleasure to be on this program today. I'd like to thank the organizers of this program, HIFU, and for everybody who has made this possible. My name is Abayomi Ajayi, and I'm the MD of Fibroid Care Center at Nordica here in Lagos, Nigeria. And this morning or this afternoon, wherever you are, I'll be sharing our experience with HIFU in the management of uterine fibroids. I bring you warm greetings from Lagos, the city of aquatic splendor. And my next slide, please. Yes, and this is one of the local festivals in Lagos, Nigeria. And this is quite popular. It's when the spirits come calling on human beings. Anyway, I'll give more details about that future one. Can I have the next slide? Thank you. Yes, right to business now. Uterine fibroids are the most common pelvic tumors in women before menopause, especially in Africans, where there is an approximate lifetime risk of about 70 to 80%. And there are many treatment options for this. Of course, since it's a very common tumor amongst us, there are many management options available, from expectant management to medical therapy to non-excisional procedures like uterine embolization and, of course, HIFU or high-intensity focused ultrasound, to the most popular one being surgery, either myomectomy or hysterectomy. When we talk about surgery, we are talking about whether it's open myomectomy or hysterectomy, or we're talking about laparoscopic myomectomy or hysterectomy. All these are available in Nigeria, though laparoscopy is like available in about 10% of centers in Nigeria, but it, of course, is gaining ground. My next slide, please. Yes, and some of the things we consider when choosing how to manage uterine fibroids, of course, is the age of the patient, the symptoms being expressed, if any. What we say about fibroids, sometimes when fibroids don't trouble them, the location of the fibroids, and that's why it's so important for us to use the FIGO classification of uterine fibroids to be able to see exactly where the location is. And then again, we consider, does this patient still want to have children in the future? These are important factors to consider when we're looking at all the options available to be able to make up our mind, to be able to give the right option to the right patient. Next slide, please. Yes, right now in Nigeria, myomectomy is the commonest surgery for uterine fibroids. And it represents between 75 to 90% of the treatment of uterine fibroids in Nigeria. So that shows us one thing: the majority of the women who have fibroids in Nigeria also want to retain their uterus. And that's why they're doing more myomectomies than hysterectomy. And that's very important as we go along. Next slide, please. Of course, we know that the complications from surgery could include hemorrhage, the need for blood transfusion, anesthetic complications, and sometimes inadvertent hysterectomy. I mean, that's when you don't plan the hysterectomy, but during the surgery, you have to end up doing hysterectomy. And don't forget what we said, that majority of the people who are doing this myomectomy, they're doing it because they want to retain their uteri. And then we have some other late complications that will arise from this surgery, like embolic phenomenon. Some of them have PVT, some have pulmonary embolism after that. And because of the surgery, sometimes also some will develop intrauterine adhesions, which we further prevent them from getting pregnant. And some will have recurrence. So these are some of the complications that come from the present situation of things. So my next slide will talk about how HIFU is transporting us from the present reality where we are into the future. Can I have the next slide, and then you can interpret? So this is what HIFU is doing for us in Nigeria right now. It's taking us from the present, which we have painted the complications, the inherent complications, and it's taking us to the future. which we hope will be less filled with complications, and we improve the quality of life of our women. And the million-dollar question most of the time is, what is HIFU? People ask when you say HIFU, 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 because probably they've never heard of it before, especially in this climate, Nigeria and other parts of Africa. So HIFU is high intensity focused ultrasound, and is a non-invasive technique that uses non-ionizing ultrasonic waves to heat or ablate tissue. And the principle is so simple. It's like almost child's play. You know, many years ago when we were kids, we used to play with magnifying lenses, and we can converge the rays of the sun to a particular spot and put a piece of paper there, and usually you see catching fire. And that is the principle of HIFU. Converges ultrasound rays, and then at the point at the focal point, there is heat energy being released. And that's how this works. And it burns that precisely at that point. Next slide, please. Yes, this is not a new thing. The Fry brothers in University of Illinois were the first to think about how to use this convergence of ultrasound rays, and they tried to use it for ultrasonic neurosurgery. And this finally led to the first commercial HIFU machine, which was launched in Europe in 1994, called the Sonoblade 200. And of course, there have been vast improvement on this machine to what we have right now. Can I have the next slide, please? And this was what actually, this picture is what changed the whole landscape in Nigeria. I'm probably in Black West Africa. When I came across this this wonderful team from HIFU in somewhere in Singapore. We had this picture in Singapore. And of course, you recognize Professor Wong and you and Rosie. And yeah, it's a beautiful team. And we had this meeting that finally led to us introducing HIFU into Nigeria. Can I have the next slide, please? And of course, we all know this is the JC200, which is the machine that we have right here in Lagos. Probably you also have in many parts of the world right now. Next slide, please. So how does HIFU work? Okay, this involves using a transducer, which is a transducer. This is what I'm pointing at, to concentrate ultrasound that can penetrate easily through human tissues into target lesions. Like this is a fibroid, and or sometimes when you also have adenomyosis with it, and then you guide this focus or the energy with either through MRI or ultrasound. Of course, the HIFU machine uses ultrasound guidance. And what happens at this point is that the energy of the ultrasound, the acoustic energy of the ultrasound is converted to heat at the point, at the focus where the focal point. And then this raises the temperature at this focal point about 60 to 90 degrees centigrade, and it causes irreversible and instantaneous coagulative necrosis at the target tissue. This is like heating up the tissue, and then because the tissue is made of protein, when you raise the temperature, it goes into coagulative necrosis, and then you sort of kill the target tissue at that point in time. And so that's how HIFU works. Can I have my next slide, please? The question most of the time, next slide, please. The question most of the time is that it's HIFU for everyone. And we say no. Unfortunately, as good as it sounds, we wish it could be for everyone, but it might not be. It's not everyone who can, especially in our own environment where we need to also, and in every environment, need to be able to choose the right option for the right patient. So because the focal point is about 12 to 14 centimeters, we need to make sure that we have enough distance where the ultrasound can travel. So when patients are significantly obese, then it might be difficult to use HIFU on them. So the cutoff point that we have used in Nigeria also, which also in many parts of the world, is that patients should not be more than 120 kg for them to qualify. But these are relative contraindications. They are not absolute contraindications. What we do when you have any of these relative contraindications is that we must do a simulation and see that you can do, it's possible to treat you via HIFU before we go on. For patients who have had a previous surgery and is a midline vertical incision, also we need to be wary because when we're using HIFU, the fear of the gut is the beginning of wisdom, like I say. So we are always mindful that the intestine is not attached to the midline vertical incision. That might not hold if you had a transverse incision, which we call a phanestal incision. Then the fibroids type 0 and type 7 fibroids, this is a type 0 fibroid. This is not a fibroid that is suitable for HIFU. This kind of fibroid is better treated with hysteroscopy. But what we are doing now sometimes is that because the majority of our patients don't just have single fibroids, they can have a lot of fibroids. And so even if you have a type 0 and you have type 4, you have type 3, all of them in the same patient, we can do HIFU for the other types and still come to do a stereoscopy for this type 0. But like I'm saying, like I said, type 0 is not a very good fibroid for HIFU. The second type that is not particularly very good is the type 7, the subserous pedunculate. This is also not a very good fibroid for HIFU. This is better done laparoscopically. When we say type 0 and type 7, then these are not the best fibroids for HIFU. Patients who have had a previous history of abdominal liposuction also, we need to be very careful with them. And patients who are not suitable for analgesia and sedation, since we don't use anesthesia in HIFU, what we use is analgesia, then we try to avoid this also. And patients who have communication difficulties are also not a no-no for HIFU, since they need to be able to communicate with us throughout the procedure. And so if you are not able to communicate, this might be a no-no for HIFU. Can I have the next slide and then you can take the presentation? Yes, now, so we've looked at the relative contraindications, but now we talk about the absolute contraindications. Patients who cannot have HIFU at all. Patients who have had a history of radiotherapy on the lower, or if you've had cancer treatment or any reason to have radiotherapy in your lower abdomen, then you might not qualify. Patients who have fibroids who are suspected of malignancy. Once we suspect malignancy anywhere in every region, we do not do HIFU. And that's why we also, before, one of the things we do is to do a colposcopy, also to see that there is no cervical fibroid. If we see ovarian tissue that is suspected of malignancy, we don't do HIFU. And the last category of patients are patients who cannot lie prone for at least 1 hour because either they have orthopedic lumbar diseases or any other cause of cardiac diseases that cannot make them lie down for at least 1 hour. They do not qualify. So those are the very few patients who don't qualify for HIFU. Yes, thank you. Next slide. I think you're good. Okay. Maybe you should interpret that and then we go to our experience in Nigeria, what we have done in the last 1 year. Experience in the last 1 year at the Fibroid Care Center. Well, significantly, today actually marks the first year anniversary that we commissioned this Fibroid Care Center in Lagos. When Samuel and Dr. Zia were here in Nigeria to help us in setting up this clinic. Now, as of yesterday, we have done 143 patients, but I'm presenting minus the one we did yesterday. We've done we did 142 before the this presentation was prepared, we had done 142 patients in 1 year, and the 116 of these were uterine fibroids alone, and in 20, the fibroid coexisted with adenomyosis, and in 6 patients, only adenomyosis alone. Of these uterine fibroids, 87% of them were hypointense, which means they're very good for HIFU, and the 13% were hyper intense. Can I have the next slide, please? And this is an example of hyper intense and hypo-intense that we're talking about. Yes, fortunately, majority of our fibroids are hypo-intense that we've seen so far. Next slide, please. Then, yeah, we could see when the presence of adenomyosis, the thickening of the, and then we can see when fibroids coexist, and yes, next slide. And this is the demographics of the patients that we have seen. They're between 24 and 50 years, the patients that are presented to us, 142. And out of this, 53% of them also have, just like we said, when we're looking at the present future of a situation in Nigeria, that myomectomy is the commonest reason why the surgery that is done for fibroids in Nigeria. We see why this is so, because a large number of them also have infertility. And that's one of the problems we're having now, because some people think that their infertility will also be cured once they have, when they do HIFU, treating the fibroids will also treat infertility. And that's one of the things that we're trying to let people understand, that fibroids does not necessarily have to be the cause of infertility. So, because we know also that there's a lot of male factor infertility. In the 142 patients, we calculated the average ablation rate. And this means that when we're doing the treatment, we use sonoview to microbubbles to see what percentage of the fibroids we are able to ablate. And our average ablation rate is 85%. So, and this is so good, because this is like what you want to dream of when you are ablating fibroids. And we're not, that's probably because the majority of our fibroids are hypointense. So we've been able to achieve an ablation rate of about 85%. Next slide, please. And when we look at the shrinkage rate, 3 months, 6 months, and 9 months after, 73 patients have been able to have 3 months post-HIFU shrinkage rate using ultrasound, and the average shrinkage rate is about 35%. 6 months post-HIFU has been about 7%, and 9 months has been about 7. We've not had any yet who has had, I think only, yeah, we had one. I think we've had one now who has had 1 year post-HIFU shrinkage. Well, please, next slide. And because about 53% of our patients have infertility and who might be candidates for IVF, we are also following them with post-HIFU hysteroscopy. And again, because some of them, 26 patients have had this hysteroscopy post-HIFU. And this is the finding: 6% of the 6 out of the 26, it was just diagnostic. There was nothing to remove. But as many as 20 out of the 26 had to have, they had submucous component to their fibroids. This is not really something that is strange to us, because a lot of our patients have multiple fibroids, and they're usually very big. And so it's not uncommon. So out of the 142, 26 have already had post-HIFU hysteroscopy. And then because, of course, again, 53% of them have infertility. So we need to be able to know that everything is all good before they start there. Now, only 4 patients have had IVF with us after HIFU. And unfortunately, I think they're still in the majority of them are still in the euphoria, thinking that HIFU also cures their infertility. So you see 43-year-olds coming and saying that I want to use my eggs because they feel good now, and they think also that the quality of eggs is improved. And that's one of the things, the challenges we are trying to take them through now. But one of the patients who is of good age has had who had HIFU for fibroids and adenomyosis, is now pregnant after IVF treatment. We just hope that we get more of this so that we can also be able to collate the data and be able to tell who are the best patients that we should be taking on, especially when they have infertility for HIFU. Next slide. Okay, maybe you better do the interpretation before I go into the complaints that we had from patients. Now, I want to go over some of the complaints that we've had. A majority of these complaints are transient complaints that happen immediately post-op. 21 women complained of lower abdominal cramps, which is not unusual after HIFU. 3 women complained of transient leg pain. 7 women complained of lower back pain, and 16 women complained of skin burning sensation. I must say, these are just, like I said, it's out of the 16, it's only one that has a first-degree skin burn, which of course we just applied dressing to. The others, there was no skin burn. So next slide, please. Now, after 1 week, and some of them after even 2, 3 menstrual periods after HIFU, about 10 women complained of heavy menstrual bleeding, still persisting. And 4 of these women had HIFU treatment for adenomyosis. And this has made us to modify. When we started, we were doing, after the HIFU treatment for adenomyosis, we would do 3 months of Zoladex injection, but we've extended it to 6 months after the this first 2, 3 patients that had heavy menstrual bleeding after, which we saw that actually decreased after the only resumed after they have stopped the Zoladex. So we're doing 6 months of Zoladex. And one problem that we're still having with patients with adenomyosis is that none of them has been able to take a Pyrena, even when we offer them, because of the fact that we know that majority of them are, and they're finding it difficult to who's having an IUCD when they have infertility together. But it's something, because with any new technology, you need to let people, what we're going to be doing now is putting step by step before them, even before they go on what can happen, what we might need to do. So we're learning from our experiences. And 6 out of these 10 women also had type 2 to type 4 fibroids, who still had heavy menstrual bleeding after HIFU. One of the things that we know is that it's possible to HIFU treatment because it's ultrasound, and therefore the ovarian reserve is not affected. And that's one of the data we're also collecting. We're doing the AMH for women below 37, and what we have seen, we have not finished compiling all our data because, like we said, today is actually the first year anniversary. So we are going to compile our data and be able to publish some of the experiences that we have, including the AMH value. There are 10 women complained of mild watery vaginal discharge, after which persisted for about 3 months, and they are all in the care. Like I said, only 1 patient had mild skin burn after the HIFU procedure, was around the umbilicus, 0.5 cm, which only required dressing. But 1 patient also had persistent pelvic pain after the treatment, and this is a patient who had adenomyosis. The explanation is likely that she also has endometriosis in other parts, and which is one of the things also that we're going to be looking at. Who are the people, especially when they have deep endometriosis together with the adenomyosis. This is one experience that they might have. The pain might persist even after the HIFU. And this one of the things that we learned this 1 year experience. Yes, so all that's left for me just to conclude now, and I'll say that HIFU is well suited for our patients with uterine fibroids because majority of them also have infertility and they want to preserve their uterus. And also, fortunately, also majority of our fibroids are hypointense and therefore well suited for HIFU. And also, we are lucky that HIFU does not adversely affect fertility from all the data that have gathered about HIFU, including the ones our own experience here in Lagos, Nigeria. And one thing that actually excites me about HIFU is that I think over time, because we've also gathered some of the information with our patient with adenomyosis, comparing them with those who had surgery for adenomyosis, and I'm believing that the future is very bright for patients with adenomyosis who are treated with HIFU. And it's not unlikely that it might become the first choice in the treatment of patients who have adenomyosis and are desirous of future pregnancy. Of course, we need to do randomized clinical trials in order to be able to make this kind of conclusion or this kind of. And we are very ready and we're happy to join the HIFU family. And I can see Dr. Jody Rodriguez, who has joined us now, who have contributed a lot to this. We're also happy to be part of this so that we get enough data to be able to make this kind of assertions on this beautiful technology that we have. Thank you so very much for this.
I'm going to speak about our experience in the treatment of uterine fibroids with ultrasound guide HIFU. And well, the first thing is, uterine fibroids are very prevalent and cause significant morbidity in women. And of course, there is enough evidence about their negative impact on fertility. Okay, all you know this condition. Although the surgery has a significant complication rate, sometimes major complications, myomectomy is still considered the gold standard for women who want to preserve the uterus. And that is surprising considering that we currently have other minimal invasive treatments for our patients, occlusive procedures and non-surgical ablative procedures such as radiofrequency ablation, and of course, ultrasound guide HIFU. In my opinion, we should have knowledge of all of them and discuss with the patient which is the best option for her. Now, okay, well, from the presentation that preceded me, everyone already know what is HIFU, what HIFU is, where it originates, and how it works. So I won't spend so much time on these aspects, okay? Just to say that the ultrasound guide HIFU technique, in addition to being approved by the UK NICE, in 2019, the SG Working Group on Non-Surgical Ablative Therapy of Benign Uterine Disease was also created, of which our HIFU unit in Spain play an active role. And currently, according to the Focus Ultrasound Foundation, more than 128,000 women with uterine fibroids have been treated throughout the world. And this number is growing year by year. Okay, the therapeutic principles of this technique are really simple, but at the same time, amazing. The effect is very similar to that produced by a magnifying glass when it concentrates the sun rays, okay? But these concepts perfectly, okay? And its safety and efficacy is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear and sharp boundary between dead and live cells, okay? And this is the procedure, okay? On the right of the video clip is played in fast motion. You can see we make an ultrasound pre-scan from the sagittal view during different sections with 5 millimeters separation, but these concepts, I think, as previously mentioned, how it works. Okay. Well, We can control the treatment by contrast-enhanced ultrasound during treatment, or contrast-enhanced MRI after treatment. Okay, in both cases, you can see here a number fuse volume of 100%, which is our objective. Okay. Well, as you already know, after HIFU treatment, the fibroid will progressively shrink, and the patient will present different degrees of clinical improvement. So that the follow-up in our center consists of performing an ultrasound 3, 6, 12 months and annually to calculate the volume reduction of fibroids, and at the same time examine the symptom severity score with a specific questionnaire. Well, and this is our 14-year experience. To date, we have treated a total of 862 patients, and 18% of patients were treated in 2 sessions, okay? As you can see in this picture, only in 52 patients, the treatment was not achieved here, okay? 6% due to different problems such as pain, intestinal gas, air in the bladder, or for example, poor visualization due to obesity and other factors. Among the treatments among the treatments completed, 94%, 68% were successful, and 32% require a surgical procedure, hysterectomy or myomectomy. Okay, the mean age of the patients treated was 41 years. In 68% of the patients, the main symptom was hypermenorrhea. The mean fibroid volume was significantly higher than that of most series, 163 cubic centimeters, with an average maximum diameter of 7 centimeters. And very important, 43% of these patients, of these fibroids, had a high vascularization. The mean non-perfused volume, therefore, was 60%, and with a failure rate of 52%. But not all cases are the same. The efficacy of the treatment depends on different factors, as depth of fibroid, type of fibroid, obesity, fibroid location, different factors that can condition the treatment. Okay, of all the factors, the most relevant is the type of fibroid. Funakis classification, fibroid type 1 or type 2 or type 3, depending on T2 MRI signal intensity, comparing with the skeletal muscle and the myometrium. Type 1 and type 2 fibroids are hypointense or as iso-intense and have a good response to HIFU. On the contrary, type 3 fibroids are hyperintense and response is much worse. The other factor to consider is the grade of vascularization. You can see different response between high vascularization fibroids at the top here, okay? Look at the small non-perfused volume in the center of fibroid, and low and medium vascularization fibroids below, with a large non-perfused volume after HIFU treatment in both fibroids, okay? This differentiation is a constant in all publications and also in our experience. Well, the overall results of our series show a decrease in the volume of the fibroids. After 12 months, the mean volume shrinkage of the fibroids was 50%, okay, reaching 67% at 5 years. In parallel, the symptom severity and the quality of life scores were reduced more than 20 points, which has been identified as discriminator of clinical healing. The complication rate was only 7.5%, mainly first, second degree skin burns that did not leave sequels, 22 cases. Only 2 patients had a major complication, which was a 3rd grade skin burn. And there were other minor complications with no consequences. It should be noted that there were no cases of bladder or bowel perforation, and no patients developed amenorrhea after HIFU treatment. Therefore, 7% of minor complications in our series, and 0.4% of major complications, which are lower than those of standard surgical procedures and other minimal invasive techniques such as uterine artery embolization. Okay, you can see here 52% and 3%. Okay, and another advantage of HIFU over these other procedures is that HIFU is always an outpatient treatment in our center. All the patients were outpatient with outpatient treatment. Okay, in relation to fertility, as previously mentioned, HIFU safely and effectively achieves ablation of uterine fibroids without damaging the surrounding myometrium. HIFU also preserves ovarian and endometrial function. We have some studies that show no significant difference between the anti-Muller and hormone levels before and after treatment. In this other prospective study from 2020 on the right, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing HIFU ablation for uterine fibroids. So the objectives of HIFU ablation of uterine fibroids in women with gestational desire, on the one hand, is to achieve the inactivation of the hormonal and vascular function of fibroids, okay? On the other hand, of course, to shrink them in order to normalize the uterine anatomy. Logically, this second objective is especially important in submucosal fibroids, but both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, we already have several publications with good pregnancy outcomes after HIFU treatment. Large series with high gestation rates obtaining full-term pregnancies with a normal delivery and without complications. No cases of uterine rupture or abnormal placentation. Our experience is not so much different from all these publications. In our retrospective study, we include 560 women with symptomatic uterine fibroids who underwent ultrasound-guided HIFU between 2008 and 2018. Between 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancies after HIFU treatment in a Western country. The pregnancy rate was 34%, which is not bad if we compare with other treatments. Among the 71 pregnancies, there were 43 successful deliveries, including a natural twin gestation, with an incidence of cesarean section of 43%, which was much lower than in patients undergoing myomectomy or uterine artery embolization, okay? Or in those reported by other authors after ultrasound-guided HIFU, which was between 50% and 81%. Okay, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids or pregnancies following uterine artery embolization. The mean birth weight of the 44 newborns was 3 kilograms, okay? 7 of them were low birth weight infants, these that you can see here, except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction. The remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. Okay, these are the few complications detected during pregnancy. 1 preterm labor, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes, okay? And during delivery, 2 cases of emergency cesarean section for fetal bradycardia and for hemorrhage associated with placenta previa, and 3 cases of retained placenta with manual removal and 1 case of severe preeclampsia, okay? It should be known that our series had no cases of uterine rupture or placenta accreta, which can occur after myomectomy or uterine artery embolization. And these results were achieved in women with a medium maximum diameter of treated fibroids of 6.4 centimeters and a non-perfused volume ratio of 76%, which is higher than that reported in most series of HIFU treatment. Okay, finally, these are some of the cases we have treated as submucosal difference of fibroids. Okay, we can treat fibroids from all locations. Okay, this is a patient with a submucosal fibroid, FIGO type 0, completely ablated and disappeared 6 months later with good pregnancy results. You can see 2 months after this magnetic resonance image. Okay, these other cases as a patient with a subserosal pedunculated fibroid, FIGO type 7, completely ablated. You can see here, the non-perfused volume is 100%. This is another case, a transmural fibroid successfully treated with HIFU and with hysteroscopic resection of the remaining myoma fragment 6 months later or later. And this woman became pregnant spontaneously 3 months after this hysteroscopic diagnostic hysteroscopic. Okay. Okay, cases of polymyomatosis with fibroids of different locations in the same patient. Okay, the submucosal fibroid that you see here. Okay, this is a submucosal fibroid. Completely disappear 8 months after HIFU. Just at that moment, the patient underwent a successful in vitro fertilization and got a full-term pregnancy that ended in a cesarean section. Sorry, excuse me. One second, please. Now, okay, another case of polymyomatosis. You can see here, this is 2 fibroids treated, okay? Of course, bulky fibroids treated with HIFU. And okay, as a conclusions, ultrasound guide HIFU is a completely non-invasive and outpatient procedure. It's effective and safe to treat fibroids, which a much lower complications rate than myomectomy. Ultrasound guide HIFU makes it possible to obtain full-term pregnancies with few intrapartum or postpartum complications in patients with uterine fibroids. Moreover, due to its non-invasive nature, HIFU seems to be the first therapeutic option in women with uterine fibroids and gestational desire, with many advantages over myomectomy and uterine artery embolization. And of course, even though we have more and more studies in this line, we need more prospective and randomized studies to confirm these observations. And okay, this gentleman here, this gentleman was called Archimedes, and he was a physicist, engineer, inventor, astronomer, and mathematician from ancient Greece, 3rd century before Christ. He created a system of concave mirrors that reflected sunlight by concentrating it on enemy ships during the Battle of Syracuse against the Romans in order to set them on fire. Okay, therefore, and as you can see represented in this painting, the concentration of and focus of energy in order to destroy is many years old. Its medical application has come to us with ultrasound guide HIFU. Let's not let time pass. Let's take advantage of it. Thank you very much. 谢谢.
Hello, everyone. Thank you for giving me this opportunity as a speaker in TAIT webinar. My name is Dong-Sub Choi. I am a gynecologist and the founder of Choi Sang Women's Clinic located in Seoul, Korea. I am practicing interventional treatments on uterine and ovarian diseases. Today, I will talk about HIFU treatments for uterine diseases, like uterine fibroids and adenomyosis. The principle of HIFU is focusing energy to a point. It is very similar to making fire with a magnifying glass. And coagulation necrosis of the tumor happens by this treatment. This is a lens type US guided HIFU transducer that I use in my clinic. It makes the high intense ultrasound wave and it concentrates it to a point. The lens type HIFU transducer makes an accurate and small focal point, so the efficiency and accuracy of ablation is generally very high. HIFU systems can be classified by the method of guidance. Usually they are by MR or ultrasound. We call them MR guided HIFU or US guided HIFU. HIFU can be used to treat many kinds of uterine diseases. We also use it for treatment of endometriosis of abdominal wall or retained placentas. But usually we use to treat uterine fibroids and adenomyosis. Today, I will talk about these two commonly treated diseases. This is a real uterine specimen of two women who had each uterine fibroid and adenomyosis. They are usually benign uterine diseases and have different histological findings. Grossly, they can be distinguished by its margins. As you can see here, the uterine fibroids has a definite margin with their normal muscle layers. But adenomyosis has an ambiguous margin with the normal structures. This is a T2-weighted MR image of the normal uterus and a woman with a uterine fibroid. But in this normal uterine image, you can see the endometrium and the covering smooth and normal appearing myometrium. The right picture here is a patient with a uterine myoma. You can see a well-demarcated global lesion originating from the myometrium of the uterus. This is an image of a patient with adenomyosis. She has an enlarged myometrium with hemorrhagic spots inside the myometrium. Uterine fibroid and adenomyosis treatment options is, there are many kinds of treatments, usually surgical treatments or interventional treatments or medical treatments. Surgical treatments are invasive but curable. We can do operative myomectomy or hysterectomy. Interventional treatments are non-invasive and also curable. We have radiofrequency ablation or uterine artery embolization or HIFU, high-intensity focused ultrasound. We can also use medical treatments in some cases, but they are not invasive, but they are not also curable. We use medicines like ulipristal acetate or ruprololin or etc. When we do HIFU treatment for uterine diseases, the patient must lie in a prone position like this. Theoretically, focal points gather to make lines, and lines gather to make slices. And finally, slices gather to make a volume of necrosis. But actually, energy is accumulated, and when it exceeds the critical point, it explodes to make a volume of necrosis, which is observed as a hyperechoic appearance by the guiding ultrasound. Symptoms of uterine fibroid and adenomyosis is similar and usually classified as 4. The first is pain, like dysmenorrhea, pelvic pain, or back pain. The second is bleeding, like menorrhagia or spotting. The third is mass effect. It occurs frequency or constipation. Subfertility is also can be a problem, like implantation difficulties or uterine peristalsis disorders. The goal of HIFU treatment is making high therapeutic outcome and in the same time giving minimal impact on pregnancy. High therapeutic outcome means high symptom relief and also at the same time high uterine volume reduction. These two go together usually. The approvals of HIFU for uterine fibroid begins at 2013. The KFDA, the Korean FDA, approved ultrasound-guided HIFU for uterine fibroids and adenomyosis treatment. And on 2015, the United States FDA approved MR-guided HIFU for women who wanted to maintain fertility. And on 2016, Korean Society of Obstetrics and Gynecology made a HIFU treatment guideline. And on 2019, UK NICE also made a guideline for US-guided HIFU for uterine fibroid treatment. To check the results of HIFU treatment, we use contrast-enhanced ultrasound or MR images before and after HIFU. The non-perfusion volume, the NPV, is the ablated and necrotized volume. This is a contrast-enhanced ultrasound. The NPV by contrast-enhanced images is nearly identical with the histological necrotic area. We can also predict the damage of normal uterine structures like the endometrium. This is a contrast-enhanced MR image. We can distinguish viable and non-viable tissue by the enhancement or not. So to achieve high therapeutic outcome, many studies suggest NPV ratio more than 80%. Many researchers also found that NPV ratio more than 80% result in superior clinical symptoms improvement and also superior volume reduction. So the more NPV, the better therapeutic outcome, which means more uterine volume reduction, more symptom relief, and the less chance of re-intervention. This figure was reported on 2015, which shows that higher NPV gives more better clinical successes. This is a submucosal fibroid, and just after HIFU, you can see nearly the total volume is necrotized. So the NPV ratio is way over 80%. So we can predict this patient will have good volume reduction and symptom improvement. This patient had an 8.6 centimeter size hypervascular submucosal fibroid. In 6 months, the volume reduction from about 267 cubic centimeters to 132. The reduction rate was nearly 50% in 6 months. Symptom score decreased from 86 to 25. That's about 70% decrease of symptoms. This patient with multiple fibroids had good NPV also. The uterine size decreased 41% and the symptom decreased almost 72%. The next disease that is treated by HIFU is adenomyosis. Adenomyosis is defined as presence of ectopic glandular tissue in the muscle layer of the uterus. The only definite treatment is hysterectomy. Hysterectomy can compromise women's health and fertility in many ways, so we need an effective and less invasive alternative treatment like HIFU. As I previously mentioned, adenomyosis has a poor margin with the normal structure of the uterus, like the endometrium and the junctional zone. The function of endometrium and junctional zone is sperm transfer, embryo implantation, and also uterine peristalsis. So it may be important to preserve the endometrium and junctional zone for maintaining fertility. Planning HIFU treatment for patients with adenomyosis must be conscious of whether we need to preserve the endometrium or not. For further pregnancy, we have to preserve the endometrium, and for high therapeutic outcome, we must ablate the entire lesion, including the endometrium. This is an image before and after HIFU who wanted further pregnancy. The contrast enhanced ultrasound shows necrotic area, which does not involve the endometrium. This patient also wanted to conceive in the future, so preserving the endometrium was necessary instead of achieving maximum MPV. And also this patient preserved the endometrium for further pregnancy. But this patient didn't want to preserve her fertility, so the ablation was done to the entire adenomyotic lesion, including the endometrium. Severe symptoms like pain and heavy menstrual bleeding decreased dramatically. And we have to be aware of complications. Chungsan Medical University Hospital in Taiwan reported their experience of HIFU treatment for 4 years and the complications. They had totally 25 cases of complications after HIFU, and most of them were mild to moderate complications that subsided in a few days, like sacral pain or skin blisters. So as a conclusion, HIFU is an effective, safe, and non-invasive treatment to manage uterine fibroids and adenomyosis. The goal of HIFU is to increase therapeutic outcome, and it is important to achieve NPV more than 80%. Future childbearing is not an absolute contraindication for HIFU, but endometrial sparing may be important.